Good morning and welcome to the React Learning Series. My name is Vanessa Brewer. I am the Regional Interagency Council Program Administrator with the Department for Behavioral Health, Developmental, and Intellectual Disabilities, and my co-host is Kelly Dorman. Kelly is the Child Welfare Liaison at the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And so we want to thank you for joining us today. Today's React Learning Series session includes updates from the Department for Community-Based Services around prevention initiatives. Our speakers include Dana Froman. Dana is a branch manager with the Division of Prevention and Community Wellbeing at the Department for Community-Based Services, and Jenny Mead. Jenny is a social service specialist with the Department for Community-Based Services. So before I turn it over to Dana and Jenny, I would like to go over just a few housekeeping items. So if you haven't already, please mute your mics. We have carved out time, I think, in the middle and at the end of the session for questions and answers. Kelly and I will be watching the chat box for questions. If you want to use the chat box, or at the appropriate time, you can come off mute, whichever you're more comfortable with. This REACT workshop will be recorded and posted on the REACT's resource and training channel. And I'll put that link in the chat box a little bit later on in the session. And then also a session evaluation link will be posted in the chat box as well towards the end of the session. It's a very short evaluation, so please take a moment to complete it at that time. We do take information from those surveys and use it to develop future sessions. So we do value, excuse me, we do value your input. And as always, certificates of attendance are available by request. So you can email me if you need one, and I'll put my email in the chat box. So I'm going to go ahead at this time and turn it over to Dana and Jenny.
Good morning, guys. Happy Friday. Thanks for joining us today and giving us this opportunity to present to you. My name is Dana Froman. I have worked for DCBS 17, almost 18 years now. It takes me a minute. I have been in central office since about 2016. I've worked in the field, completed investigations and assessments and ongoing case management, worked in the child fatality program, and now I am with the Division of Prevention and Community Wellbeing, which, let me tell you, is a much brighter side of social work than where I came from. Super, super exciting. Jenny, I'll turn it over to you and let you do your introduction.
My name is Jenny Mead. I am a social service specialist with the Community Response Program with the Division of Prevention and Community Wellbeing. I have been a social worker in the front line for about 11 years, and then I went into the education world, and I worked in higher education for a little bit. And when the prevention position came open, I came back to DCBS, and that's where I'm at now. Thanks for having us.
All right, guys, I'm going to try to share my screen here as I'm working from multiple ones. Let's see how this goes. Can you guys see the screen?
Yes.
Okay. All right. So I'll kick us off and get started here. So today we're going to be talking about DCBS and the prevention continuum, and we already kind of went through our introductions here. Sorry, guys, my slideshow is not wanting to advance there quick enough for me. So really quick, just high level agency overview. Department for Community-Based Services, we have protection and permanency, which they do a lot of the policy and oversight of the child and adult protective services. Then we have family support that provides our families with benefits, SNAP, KTAP, Kentucky Works, all different types of programs there. And then prevention, which is fairly new to our agency. The Division of Prevention and Community Wellbeing started in January of 2023. And then also we have Division of Child Care. I'm going to hand it off to Jenny.
Okay. We are in the midst of a once-in-a-generation opportunity to reimagine the child welfare system based on a number of transformative new policies, new available resources, and a significant shift and attitudes held by policymakers and the public. Most notably is the new federal policy, the Families First Prevention Act, which Dana will talk about in a little bit, which was signed into law in February of 2018 and is currently being implemented in states across the country, including Kentucky. And we're very proud to say that Kentucky was one of the very first states to start implementing the Families First.
Okay. So go ahead.
Go
Sorry.
ahead.
No, you go. I just
me
wanted to
to
make
go?
sure, did it show, guys? I'm sorry. I'm having a lag. Did it flip to the next slide, Jenny?
It did.
Okay,
It did.
sorry. Go right ahead.
That's okay. So historic challenges with the DCBS. Why do we need prevention? Despite over a century of organized child welfare services for families and children, face challenges of system failures and complex individual needs. In 2020, Kentucky saw its highest number of children ever in care. Caseloads for frontline workers were at an all-time high. We didn't have the funding to sustain the system. And at that time, we began looking at tools to address the disproportionality and disparate income outcomes for children and families. We began looking at how to differentiate safety versus risk and poverty versus neglect. We know the child welfare system is imperfect, and despite years of progress, it still fails thousands of children every year.
Okay, so when we talk about prevention in this journey that we're on now, we really want to look at community collaboration, and we want to bring folks along on this journey with us. So when we talk about why do families come to the attention of the Child Welfare Agency? So a lot of times what we see is that, Jeannie spoke about just a second ago, we see a lot of poverty type adjacent reports that come to our agency that really are truly that a family just does not have the ability to have their basic needs met. There's a big difference between poverty and neglect. We'll get into that more in detail later. A lot of reports, that come into us, we know that the intention is for assistance and help, but sometimes child welfare agencies are not helpful. It can be very traumatic for families.
Each year, approximately 60% of reports to the Child Welfare Hotline involve allegations of neglect. Only 41% of those reports meet acceptance criteria, and only 19.8% are substantiated. We know that we are receiving a lot of reports that do not meet criteria for an investigation, but those reports do possibly have opportunities for support. A lot of those reports, like Dana mentioned, are reports that have poverty adjacent issues.
So here's just a quick kind of fact sheet, and it's here showing some numbers broken down by the regions here of children in care through foster care. We were, we looked, like Jenny said, in 2020, we had about 10,000 kids in care. Then we really started working on prevention, looking at things differently. Our numbers started falling. I think we got down into 78, 7,700, 70 in the 7,000s. I think now we're creeping back up over to 8,000 currently. So we still have a lot of work to do. There have been some new policy and legislation changes, though, that I do think are going to impact numbers as we move forward. But I won't get into that today. So we'll sit here. We'll move on to poverty.
Like we said, a lot of screened out reports we receive have poverty adjacent issues versus issues of neglect. Poverty does not mean neglect. We know that. In 2022, Kentucky changed its definition of neglect to reflect that a parent or guardian has to be financially able to provide for the child's needs or have been offered the financial resources to provide the child with adequate care, supervision, food, clothing, shelter, education, or medical care necessary for the child's well-being. And I won't read these to you, but these are just some indicators of poverty that we see in some of the reports that we receive that are screened out. And those provide opportunities of support, and we'll talk about how we are doing that in a little bit.
And really quick too, I know we're saying opportunities for support. So historically, the language, and we want to remember language is really, really important. I know historically and still in the medical field, we hear a lot of folks say risk factors, right? It's something that we're pretty familiar with. Like, this family has risk factors. Well, doing our work with lived experts, one of our lived experts said, just because I'm a single mom, I don't like that feeling of you saying that I'm at risk because I'm a single mom. So we try to be really intentional with the use of our language. So instead of saying that they have risk factors, we say that they have opportunities where support could be beneficial for them. So when you hear us say opportunities for support, that's just us trying to make sure that we are very conscious of the language that we're utilizing. Okay, so poverty and neglect. As you can see here, and I think this is an old map, but it kind of shows the percent of population below the poverty rate. We know that Kentucky does not stand well nationally when we look at poverty. A lot of our children are living in poverty when you look at national stats as well. There are lots of things that go into poverty. We look at, basic needs, social determinants of health. There's also lots of myths around poverty, and I want to talk about that a little bit. So I have heard this very recently, actually, and some folks that we partner with, and an individual said on a meeting that they just wanted people to do better and want better for themselves, that people were just choosing to be poor, basically, that they just needed to do better, and just kind of that attitude of pull yourself up by your bootstraps. I think, though, we know that there's much more involved there than just saying, go get a job or go do better or want better. Again, that is a myth that we sometimes fall into traps with. So too, we also know that there's policies and prejudice, there's systemic racism, structural inequities that contribute to poverty over generations. I know a lot of times we see that impact of generational poverty when we're working with families that prevent. Also, we see that families of color that, they have a much higher rate of being reported to the Child Welfare Agency. They have a higher rate when it comes to child near fatalities and fatalities, and they have a higher rate in the out-of-home care system when you look at the population whole census data in Kentucky. And then two, remembering just that poverty, the extent to which an individual, family, or community does without basic resources. It can be situational and it can also be generational. Neglect is that failure to provide sufficient nourishment, supervision, or medical and educational. So what I always like to think about is if a family has the ability to apply for SNAP benefits and they know how to do that and they have the access to get to the office, they have all their paperwork, they're simply just choosing not to do it. And they do not have enough food in the home to make sure that they're meeting the nourishment and food needs of their family and their children. That would be neglect. But if it's just that mom doesn't know about what services are available to her, or that she cannot get a ride to the family support office to turn in her paperwork, or that she doesn't know exactly all the paperwork that she needs and doesn't understand the process. Because guys, I'll be honest, it's not a simple process. I know myself, I've tried to look into in different situations for neighbors and community members that have asked me questions. It's not simple. And we know as a whole with DCBS, we're still trying to work on that and remove some of those barriers that are in place. So this is just really quick. I wanted to talk about this. We know that poverty is one of the main reasons and a huge predictor as to why children come to the attention of our agency. So we have been doing a lot of work around economic and concrete supports. It first started with economic and concrete supports that we were utilizing for families that had open DCBS cases. Either there was an assessment or investigation received, or they had an ongoing case. And that family could be eligible for concrete supports and economic supports. Well, what we've seen, I think we were granted $1 million. I think the cabinet, we went through it in a month and a half. It was no time, right? You give social workers some free money to give families, we're going to utilize it. So we know that there's a need for economic and concrete funding to help support families in their needs. So there was a study that included all 50 states and DC. They looked at where they gave each additional $1,000 that states spend annually on public benefit programs per person living in poverty. And what that basically told us, with that extra $1,000, there was a 4.3% reduction in child maltreatment reports, a 4% reduction in substantiated child maltreatment, 2.1% reduction in foster care placements, and 7.7% reduction in child fatalities due to maltreatment. I know that doesn't seem huge, but that's a start, in my opinion. And especially when I see that 7.7% reduction in child fatalities due to maltreatment, that speaks volumes for me. So really, when we think about it, I think sometimes that you'll hear individuals be concerned about just giving families money because they don't think they know what to do with it, or they don't think they should be trusted with money. However, this study shows us that families will thrive. Families typically will make the right decision when you give them some economic and concrete funding in order to support their basic needs. So also too, we want to kind of talk again, we talked about this prevention journey, this journey that we're on. The first major change that came forth as our prevention journey began is that we basically were allowed to use our Title IV funding for prevention services. Historically, Title IV funding that was funding from the federal government was only utilized for out-of-home care. So we could really only tap into that fund unless we made that, action to pull that child out of the home and put that child in foster care. We finally got some attentions, and they came forth with this Families First Act and said, okay, this isn't working. It wasn't only Kentucky that was dealing with this. We had a high number of kids in out-of-home care. We've seen the trauma, the aftermath of what that looks like for children in out-of-home care and families and what it does to those folks. And then to that generational trauma. So what's happened now is that we can actually bill for some of our prevention services and receive funding. And I don't think it's never that DCBS didn't want to do more prevention work. We just did not have the funding or the support or even the infrastructure really. We were barely able to, manage the child welfare system and the adult protective service system with caseloads, staffing. And now that basically the creation of our division, we have a whole division that is dedicated to really formulating and kind of devising these different projects and initiatives that really target prevention services for Kentucky families.
This is one of my favorite pictures. It just shows the work that we're doing, moving upstream. We're being more proactive versus being reactive, which is historically what DCBS has been. When we shift our energies upstream, we're dealing with the symptoms of the problem, or we stop dealing with the symptoms of the problem and we start fixing the problem. A new research review from Chapin Hall at the University of Chicago shows that increased investment in essential family needs results in reduced involvement with child welfare. For example, researchers found that for every $1 increase in the minimum wage, there was nearly 10% reduction in neglect reports. Additional studies show that for each additional $1,000 state spent on benefit programs per person living in poverty, there was an associated reduction in child maltreatment. And like Dana said, a 4.3% reduction in reporting, a 4% reduction in substantiations, and a 2.1% reduction in foster care placements, and a 7.7% reduction in child fatalities.
And again, I love this visual because I do think it speaks volumes, because it's showing people in the river that are getting pulled out. And I'm sure you guys have seen this before, but I even like the second one better than the first one, the one to the right here, that it's basically saying, we've got to do something, and that's, so these people in the river remind me of these kids that are sleeping in DCBS offices, right? Because we have no placements, nowhere for them to go. So we have staff sitting around the clock, and not to mention, more detrimental, we have a kid sitting in a DCBS office. I don't know if you guys have been to DCBS offices, but they're not somewhere you want to stay overnight. It's your typical state government building. And we have kids that we have no placement options. And sometimes they're staying multiple nights in these DCBS offices. So just looking at that and taking a step back and say, okay, let's build the bridge. Let's make that safety net. And let's, build better prevention infrastructure. So really quick, this is kind of coming from our strategic plan, our blueprint, kind of how we got started. So we started with this 18-month strategic plan, which came out of that. We have Thriving Families and Safer Children and the coordinating councils. So with Thriving Families and Safer Children, there's been a lot that's come out of that. We have the regional prevention collaboratives. We have, work around race, community, and child welfare. We use a lot of information from our lived experts. I think that has really transformed the work, because I may think I have great ideas sitting in an office in Frankfurt all day about what families need and what mothers need and what fathers need, single fathers, to empower them. But who am I to say what individuals really need, right? We really need to go to the source and talk to them about what would be helpful, what would be beneficial, what would have worked better in their case and scenario. We have lots of folks that we have, worked with since I've been on board, and they have been very beneficial in the building out of programs. And sometimes just even our language or a pamphlet. I know that myself and probably 50 other professionals had looked at a pamphlet that was going out to families, thought it looked great, was wonderful. We started mailing it out. Then we had a lived expert come in and say, guys, families are not going to understand this language. And I thought, you know what? She's exactly right. It just never dawned on me. So I think it's important that we really do make sure that we're utilizing the advice of our lived experts. So also with Thriving Families and Safer Children, we knew, again, where Jeannie was talking about, we have a huge number of reports that are coming to the Child Welfare Hotline because it's kind of this old way thinking of DCBS as the one-stop shop. We don't know what to do. We just want this family to get help, so we're going to call the hotline. That doesn't always get them help. So this whole thought process was talking about the community response. So community response was piloted and started. I believe it started with, I can't remember if it was 5 counties or 4, but either way, now today we're at 10 counties. Sorry guys, I wasn't around when it first started, but now we're at 10 counties. I'm eager to push it out into more counties, but we're still learning and shifting of how we're doing that work, just because engagement is not exactly where we would like for it to be. It's anywhere between 5% to mid 20%, 25, 27% with families, and we're utilizing community response in that space. We're also doing a lot of racial equity audit work. We actually have worked with Child by Design, looking at, readiness tools, assessment tools, and then also reducing indirect and unintentional negative policy impacts on people living in poverty. Again, I think sometimes we have this knee-jerk reaction, and that goes back to my system safety science days, where we think like this is a problem, so we need to fix it now. When in reality, we need to slow down and talk to all the parties that are involved and formulate a well thought out plan instead of having these knee-jerk reactions. More policies, more one-pagers, more training. We need to talk to all parties that are involved. So really quick, again, sorry, I know we sound like a broken record. Family income is the greatest predictor of entry into care. Families living below poverty line are 40 times more likely to enter the child welfare system than median income families. I just want you guys to stew on that because I think that's huge. Nationally, more than 70% of children in poverty are children of color. 53% of Black children experience a CPS investigation by the age of 18. In Kentucky, 13.1% of reports involve children who are Black. This is disproportionate to 9% representation in the general child population. And also, guys, just because I used to prepare the child fatality annual report, I know last year that report, we also found too that children of color are also represented higher in those near fatality and fatality reports. So now that we've kind of talked a little bit about poverty and what the child welfare system and the trauma, I really want to talk about this piece because I think it's super important, and I'm going to give it here to Jenny.
This shows what we're trying to do in prevention, shifting from surveillance to support. Kentucky began implementing a new safety model in 2020, clearly defining safety and risk based on research and federal definitions, and implemented new safety prevention plans. Now, when you call into the hotline, we have a structured decision-making tools. Those were implemented for assessment of safety and risk, and planned implemented for risk reassessment. And like Dana said, we're currently piloting the community response for reports that do not meet criteria for abuse and neglect. And we'll talk a little bit more about that in a minute. And we also have implemented alternative response that began in September 2023. And that's a family-centered and strength-based approach to reports that meet acceptance criteria. A transformed child welfare system shifts the focus of child safety from intervention to prevention and seeks to support and serve all families so that every child can thrive. This paradigm shift requires revisioning the overall framing of our societal response. When there is a concern that a child's environmental and living conditions may have a negative impact on their health and well-being, how might we move from report to support? In reframing, in which we prioritize the best outcomes for a child, we first ask whether there is truly a substantial risk of harm to the child. And if not, we turn the questions about supporting the child within their caregiving system to address the mandated reporter's concern about the child's environment or living conditions. When we look at the caregiving system as a whole, the key assessment and decision-making questions are, does this family have the resources to provide the care and protection they want to provide? What strengths exist within this caregiving system? What are this family's priority for their child, and how can we support them in a culturally appropriate and humble way? This frame provides a different starting place than the historically fear-based approach, while leaving in place the possibility of a referral to CPS in the case of an imminent threat to the child's health and well-being.
Okay, so just really quick, this is pulled from Prevent Child Abuse Kentucky's website. So Prevent Child Abuse Kentucky, we do a lot of contract work, and they came up with this whole kind of curriculum, and they have a whole training on Lean on Me and community supporting. So again, I'm not going to repeat all that because I know Jenny said a lot about community supporting, but I do want to remind everybody, this is not about discouraging people to call in reports of abuse or neglect. Kentucky, you know, everyone is a mandated reporter. We are not discouraging folks from calling in suspected reports of maltreatment, of abuse or neglect. But we also too want people to think and maybe slow down sometimes and think, is this truly neglect or is it a poverty situation? Is there a way that we could support this family versus reporting them to the child welfare system? Because sometimes I think, again, I've heard several individuals say, well, I made a report to you guys because I just wanted to get them help. Sometimes making a referral again to the child welfare agency is not always helpful. There is a lot of trauma that's associated with that. It can cause a lot of disruption in a family's life. And I always say too, put yourself in that parent's shoes. If you're sitting home one night making dinner and a social worker were to come to your door and knock on your door, and then you find out they need to interview all of your children and yourself individually, how would that make you feel? How would that impact you and your children? So again, this is not intended to keep people from reporting abuse or neglect. We just want people to slow down sometimes and think, is there another way that we could look at this? And is there a way to support this family? If a child is, you know, in your neighborhood and they're constantly asking for food or snacks, maybe check on mom and see if she knows about a local food pantry or food bank. Does she have SNAP benefits? Does she know about SNAP benefits? Is there something going on? Has dad lost his job recently, or has mom had a major expense in the household that she has to take care of, and it's tighter on her funds this month to buy groceries? So it's thinking outside of the box, basically. But again, you can check out Prevent Child Abuse Kentucky's website, and they have what they call a toolkit for Lean on Me with lots more information. Sorry, guys. I'm having a delay. Here we go. All right. So here's some more examples of what you can do as a community supporter. Normalize asking for help. We know that there's a lot of stigma with families. You know, they're prideful. They don't want to ask for help. They're afraid of that stigma that's going to come along with that. And also connecting with families to supports and resources. If you see someone struggling, don't just walk by. You know, I think it's just getting back to that being a good human. That is what I always like to say. Like, be a good human. Offer help, offer assistance. And I hate to say this, but I'm going to use my example from last week. I ran out to go get lunch at the local Jimmy John's, and this little lady was in a walker, bless her heart, getting her food. She was trying to get out the door. There were probably 10 people sitting down at tables waiting on food. And it was all she could do to get her food and her walker out the door. And I'm at the register, and I immediately leave the register in the middle of my order to help her out the door. It's just being kind. I think that's where we need to get back to the basics. Be a good human and be kind. You know, be aware of your surroundings. Instead of, you know, seeing a mom that's struggling in the grocery store, maybe her child's in the floor throwing a fit or has dumped her purse in the floor. Trust me, that's happened to me. Maybe walk up and help her pick up some items, or ask if there's anything you can do. Now, granted, sometimes you're not always going to have the best response from that, but I think it just shows that, again, be a good human, be that listening ear. You know, model the healthy relationships and appropriate behavior. If you're at, you know, a community event with your children or your family, model that for others to see. And then also offer specific help to others without judgment and without making promises you can't keep. That's a big thing I think that we talk about a lot with our lived experts. That is something they have shouted from the rooftops. Don't tell us things that you cannot do. And don't make promises to us that you have no intention of keeping. Because of course, what happens, we really break down that trust that we've worked so hard to build. So really quick, we'll go through the mandatory reporting challenges. We know, again, like I said, Kentucky, all individuals in the state of Kentucky are mandated reporters. Across our country, child abuse hotlines receive approximately 4.4 million referrals. These referrals, they're primarily based on neglect that impacts 7.8 million children. More often than not, general neglect cases are tied to poverty. I know, again, sounding like a broken record. Includes a lack of childcare, housing, basic utilities, food, medical, and legal support. Ultimately, mandatory reporting does not address the root causes of why a family might enter the child welfare system. Okay, guys, I know there's a lot here on this slide, but I do think it's important. So again, when I talked about that example about people say, well, I just wanted to get the family help, right? There's a good intention, right? We want to support them, but sometimes reporting them to the child welfare hotline is not always the best way to help them. So it talks about, there was this study done, and sometimes, we know out-of-home care placement is necessary. I've always said, even living in this, what I call the better side of social work and prevention, I always know that we live in a world that we're going to need foster care. Unfortunately, horrific things happen to children every day, and we are going to need foster care. But I also think too, that sometimes we've overutilized foster care. We've not thought more outside of the box ways of helping support families or keeping families together. And I think we're trying to shift that. So really, we know that more often than not, child welfare systems, we act on risk and we place children out of home for fear that something may happen. And I can tell you exactly why that happens. The media love to get a hold of those child welfare stories, right? A child died, DCBS did nothing. And a lot of times we don't respond back, right? Because of confidentiality concerns. I used to sit on the child fatality and near fatality panel review. And it was all about, well, DCBS, if they could have done this, if they could have done that. And guess what, guys? We don't have a crystal ball to tell us all the answers and how this game is going to end. It's really hard, and it's a struggle, I will say, for our staff when they are making these real-time decisions with the amount of information that they have. Yes, it's easy to pick up a case file with all of the information and know what happened from A to Z and make judgment calls and what I like to call the Monday morning quarterbacking. But when you don't have all that real-time information and you're trying to make the best decision that you possibly can, sometimes, again, they do react out of fear, and sometimes they're trying to do what's best for the family or what's best for that child. So it's really hard to weigh. So I just wanted folks to just kind of remember that. And also too, just research shows that for children who've experienced child maltreatment, out-of-home placement provides little to no measurable benefit in terms of cognitive or language outcomes, academic achievement, mental or behavioral, or suicide risk. I think about this as I think about the times that I would sit in the courtroom on a Friday and we would get teenagers placed in foster care because they would not attend school. And guess what? When I placed them in a foster home, do you think they went to school? They might go for the first week, but then guess what? They run away. I had one actually run away from the conference room at a family team meeting with his mom. And then we were looking and searching for him all night. So just again, I just want you to think about that, what that looks like. And really quick, I just wanted to kind of pop this up here. I'm sure you guys have heard of Connect. If not, go visit the website. If you want to find ways to help support families or you don't know of resources that are available, you can utilize Connect. Of course, in Kentucky, there's all kinds of support and resource apps. I know there's the MyKY app, which I've heard great things about as well. I know that they're still doing a lot of work with Connect because I know that it's not always super user-friendly and there are some glitches within the system, totally admitting that. But I know that there's lots of work that's happening in the background that they are trying to improve Connect, where we can actually do referrals straight through the Connect system for families on their behalf. So really quick, I know that was a huge dump of information and we have more information to go, but I wanted to give you guys a time to see if there were any questions or comments or reactions. Nothing?
You all are free to come off mute to ask questions.
Hi, thank you so much for the incredible information. Something that caught my eye was I may be mispronouncing it, but is it the PCAKY Lean On Me campaign? So if I was interested in getting this for our Aspire Day School teams, would I essentially use that link provided to try and get some trainings?
Yes,
Awesome.
absolutely. They can come in person too if you would like. But you can also do it online. But yes, they will also do in person. I don't know what their schedule looks like. I know they just hired some newer folks on, but they do a lot of in-person on the road trainings as well around the Lean On Me.
I appreciate that because I feel like it encourages that holistic system of care that we're striving to work towards. So thank you so much for including that in today's presentation.
Absolutely. They're a great partner that work with us. Any other questions? Okay, guys, just, pop in the chat or interrupt me. I don't mind as we go if you have other questions. All right, really quick. We have a small activity. I promise we're not going to make you do breakout rooms or anything like that. Nothing too bad. All right. So here we go. Scenario 1, and you guys can come off mute or you can put it in the chat. When we talked about that Lean On Me and community supporting versus reporting, I want you to think through this. So this is a situation we actually see quite often. We know that in the state of Kentucky, other states as well, we have a lot of relatives, fictive kin, grandparents, especially that are raising children. Here's our scenario 1. Grandmother struggling with her teenage grandson, who she's been raising since he was 8 years old. He's now 15 years old and he does not want to go to school and has been caught skipping school. School has notified grandma that he is facing truancy, but she simply cannot make him physically go to school and she doesn't know what to do but needs help. Now, I know it's Friday and you guys are being pretty quiet, but I'm sure you guys have great ideas of what we could do with this situation. How would you react? If this grandma was coming to you and saying, I don't know what to do, he won't go to school, I've tried everything, he's bigger than me, I physically cannot get him out of bed and make him go. Or sometimes maybe grandma drops him off at school and he leaves school grounds. We know that happens too. He walks right out the back door of the building.
So I'll jump in, even though I'm a co-host and maybe I'm not supposed to do that, but since I've actually parented through this situation and been a previous social worker, which dealt with the situation a lot, obviously we all know there's an underlying reason this child is not wanting to attend school. So at some point in time, we really need to engage with that child and figure out where's the barrier, why are you not invested? Definitely need supports for grandma. So I know there's specific programs like high fidelity wraparound facilitation, like the team approach where they engage the school, kid, family, and really do that whole holistic approach. I know from previous experience, calling law enforcement to get the kid to school, not a great option. We really want to be a positive support when children are struggling with making the best choices. And some kids, school's not always fun for everyone. So anyway, that's my initial thought.
Yeah. I see a hand up. Go ahead.
Hi. One of my suggestions would be, because I know how important knowing that someone else could understand the journey that you might be enduring would be, is to potentially see if there's any agencies where there's youth peer support that could maybe come in and be that mentorship.
Yes.
We've actually implemented that at Aspire too, because we understand the importance of having someone with that lived experience to kind of help you work you through the process of understanding. Like you said, there's a reason why he's not wanting to go. What is that reason? And sometimes we just need to hear it from a different voice to kind of support that. So that's something that I'd suggest.
I love that. I love it. Yes, absolutely. And I know that there's a lot of work too with youth cafes that Department of Public Health is leading. There's going to be parent cafes and youth cafes. Gosh, guys, I can't get my words out. So that's also going to, I think, will be impactful as well. So no one would call this family into the child welfare system. That's not an answer. All right, let's get to the second scenario. Sorry, guys, I don't know why I'm lagging here. Okay. 7-year-old Roberto has been coming to school and appears to be more disheveled than he typically does. I had to use that word because I see that at a lot of central intake reports. Sorry, guys. But they appear disheveled. He does not always appear to have had a bath, and his clothes are sometimes dirty. In the lunch line, the teacher caught the child sneak away into the Family Resource Center room and was caught taking food without asking. When Roberto was asked about the situation, he stated that Dad had lost his job and their electricity was currently turned off, but they are working to get it turned back on. He stated that he does not have a lot of food at home currently, and that is why he's trying to sneak some snacks. All right, guys, what could you do in this situation? All right, I see some comments. Find a way to get the family the resources to manage their current financial situation. Yes. Anybody else?
Comments
Anything
say food pantry, backpack program, LIHEAP.
Yep. Lots of ways to provide support, right, guys? But I'll be honest, this is the scenario we receive a lot at Central Intake too, is this type of situation, and the first one.
This was actually a real life scenario. When I was a teacher, I had this happen.
Oh yeah, connecting them with case management services that are committed to making it. Yep. I like these guys. Good job.
And you notice they're all just like positive supports.
Mm-hmm.
Mm-hmm.
That's where everybody's going with this.
Mm-hmm. Yes.
And I wonder what the responses may look like in a different crowd. You know, we're all social workers and, you
Oh,
know.
I could only imagine. I bet I could guess though. Well, and Kelly, I want to go back to something really quick. You said, when we talked about the grandmother and the 15-year-old not going to school, I know too, back in the day, we would utilize law enforcement to try to get the kid to school. And finally, I had an officer tell me one day, this is not our job. We do not want to be seen to children as we're the scary people to make them go to school.
Yeah.
And, I've had individuals say too, when a parent says, oh, you better behave or I'm going to go get that officer. A lot of those, that's not their role. We want our children to know that there's somebody safe to seek out if something's happened to them or if they're scared or need protection. So just keep that in mind too, guys. I know that can get a little tricky, but just to kind of keep that in mind when we're utilizing other folks. And, I know our law enforcement agencies, I know especially here locally, they're working more to hire social workers and advocates to work in their agencies to help support them in their work because they want to do good community work as well. Okay. All right. Again, we kind of talked about this. We have to have, in order to do this supportive system, right, to have this great prevention network in the state of Kentucky, we really have to work at our partnership and engagement. So DCBS is the child welfare agency. Again, we're not the one-stop shop. We're not the child welfare system. Real change has to be family, youth, and community driven. So when we talked about, I mentioned earlier, these youth cafes and parent cafes, they even have provider cafes. Looking at, getting the ideas from these individuals. And remember, guys, earlier I said, I may think that I know everything that a family needs. I have no idea. And communities look different across the state of Kentucky. We need to go to those communities and talk to those folks that are experiencing the day-to-day in that community and where are their gaps? What do they need? Because my community may look totally different than Kelly's community. The services may be different. The cultural makeup may look different. The school system, the school setting, it may all be different. And I guarantee you it probably is. So that's something that we need to keep in mind. And increased investments in primary and secondary prevention also to help avoid the child welfare involvement. Again, remember that's that upstream picture of when they're in the river and we're trying to pull them out. That's that third level of prevention. That's what we've always done. It's that reactive type of prevention. So now we really want to look at how can we do upstream? How can we really engage in that primary and secondary realm? So again, we talk about, working a lot with our lived experts, talking to birth parents. They know what they need. Also realizing that racism is a really source of toxic stress. And we know that our system, we have systemic discrimination built within our system. We know that. The child welfare system is experienced as a source of toxic stress by families. Remember, guys, remember what I told you. Imagine you're at home one night, you're cooking dinner for your family, and a social worker was to come and knock on your door and say that someone made allegations against you. How would that make you feel? How would that make your children feel? Instead of focusing on how can we impact or change the parent or family, would our efforts not yield greater results if they were directed at creating healthy communities and improving social determinants of health? So again, making safer communities, making resources more accessible to families. Sorry, guys. Is it coming up? because it's spinning on my side. I don't know what's up with my, okay, there we go. So this is just a kind of an overall visual. I don't like this visual anymore. I'll be honest, guys, but this is the one that we have. So this is for our division. So this primary prevention, that's really that first level of prevention that we talked about. We'll kind of get more into the weeds. That's where we start. And then we get along the road, then we have the secondary, which is the community response and well-being. Really looks at where can we provide opportunities to support families that have those needs. And that prevention and evidence-based practices, that's that third level of prevention. That's where we're using evidence-based practices to either prevent further maltreatment or to help families reunite with family reunification services. Let me get here. So primary prevention, my coworker, Margaret Perkins, she is the branch manager of primary prevention, and she has 4 specialists now that are housed there. So primary prevention really looks at the Lean On Me initiative, as you can see, is one of the road signs. That's something we talked about. How can we support families? How can we be there for them? How can we make sure that they're aware of resources in their community? Community collaboration for children. That's a service that we have contracted that can be available to families that are not involved with the child welfare system. They can self-refer, they can be referred by community members, educators, physicians, doctors. We're also looking at building, again, those communities that can support its citizens within. So where are the gaps in services? What does that community need? What does it look like? What does the culture look like there? And then also the work that we do with Prevent Child Abuse Kentucky with all the trainings, the support that they give us to, again, get the word out there. Just again, like with Lean On Me, and then our community partnerships, looking at social determinants of health, making sure that individuals have access to healthcare, affordable healthcare, and fatherhood engagement, making sure that we're also engaging with our dads. We have not done a great job of that at DCBS. We a lot of times focus on moms, and we don't remember that dad's there too. And sometimes we forget to involve them. So something I'm talk about with primary prevention, we look at safe and stable housing, high quality preschool. We really want to focus on that early childhood, nurturing and safe childcare. Again, looking again at that early childhood, if we can prevent any ACEs or adverse childhood experiences, and promote positive learning and growth. Medical care, mental health services, we talked about making sure that folks have access to that. Economic and financial support, those economic and concrete supports that we mentioned earlier. Work opportunities with family-friendly policies. This is something I would love to tackle, and I don't know how we're going to tackle that yet, but I know that there were some places that they had daycares and childcare centers within their place of work, or they had policies that were not as strict and punitive. I know that some of the production and factory type work, they have point systems. And if you have a child that's sick and you have to take off a lot, sometimes that can end up in a mom losing her job. So just looking and trying to engage with partners and, looking at, the local businesses in the community and talk to them about being a more family friendly and supportive environment. Also with primary prevention, I wanted to talk a little bit about this, and this is fairly brand new. We have our first library convening coming up. And I know people may ask, like, what are you doing with the libraries? And I asked the same question at first, but our director had this great vision. So there is going to be a huge library convening in Louisville. Registration's closed for this one, but hopefully if this one goes well, we'll have more library convenings across the Commonwealth as time goes on. So what we know is that a lot of times in certain areas where there is a library, folks will sometimes go there for water, to use the restroom. Sometimes we see our homeless population folks coming in and out of libraries. So we thought about what's a way that we could put resource hubs in libraries where families go, or what's a way that we could attract families into the libraries. And I know that libraries now do a ton of work with the early childhood education. They do a lot of summer programs and classes and workshops that can really promote positive parenting and child interaction. So just really thinking outside the box, we're going to see how this library convening goes. Just kind of bring everybody in at the table and try to really think through how we can provide more access to resources and work with them in meeting children's needs, again, in that early childhood realm. They even have little play centers in a lot of our libraries. Now, I don't know if you've been and visited your local libraries, but a lot of libraries I know across the Commonwealth have had some new updos and makeovers, and they're very child friendly and lots of resources. There's resources to Wi-Fi, free internet. I know a lot of libraries now you can actually check out a hotspot box if you need internet. So that's just one way that we're kind of tapping into that resource. So we hope that our partnership will continue after the library convening. I'm actually going to miss it because I'm going to be on vacation. But I cannot wait to hear from my colleagues on how that goes, and hopefully we can continue that work. All right, Jenny.
Okay, so secondary prevention, that's the team that I'm on. Uh, Secondary prevention activities focuses on offering services to at-risk populations, although we don't really use that word anymore, with one or more risk factors associated with child maltreatment, such as poverty, parental substance abuse, or parental mental health concerns, and may be focused on communities with high incidence of identified risk factors. The scope of work and responsibilities for the Community Response and Wellbeing Branch include administering the collaboration of community response programs, administering a state plan for secondary prevention, and administering a plan for collaboration with other family agencies and parents. A formalized structure for administration of services to families of children at risk of maltreatment is necessary to curtail rates of abuse and neglect in the state, including community response to child welfare hotline reports not accepted for investigation, and safety net or economic supports to families. In addition, administering a formalized state plan for secondary prevention and a plan for collaboration with other family service agencies and parents supports the development of a robust network of community-based prevention supports, valuing the contributions of those with lived experiences. Can't get my words out. So what is community response? Reports to DCBS that do not meet criteria for assessment or services are referred to a community-based agency to offer supports or resources to families. The overall goal is to strengthen families, prevent child abuse and neglect, and reduce further reports or future reports to DCBS. Connecting families to community-based resources and supports before maltreatment occurs prevents trauma of maltreatment and family separation. Reduction of future reports to DCBS allows CPS staff to focus on the most critical safety issues. Other states are utilizing partnerships with family resource centers or other community-based agencies for this purpose. Why community response? As we discussed earlier, less than half of the reports to DCBS meet criteria for any type of service or response. Today, these families are not referred for other services in a meaningful or structured way. Mandated reporters may falsely assume that a family's need has been addressed, and it's also the greatest missed opportunity for true prevention of child maltreatment. That's where we go back to that visual of working upstream, being proactive versus being reactive. If we see that there's an opportunity for support for a family, hopefully by us getting in and working with the family earlier, we can prevent future maltreatment and prevent this family from having to come to the attention of child welfare in the future. Community response pilots. Historically, families have not been referred for other services in a meaningful or structured way. So this is something new we are trying in Kentucky. Mandated reporters may falsely assume that a family's need has been addressed. Let's see. Okay. I thought that was the same slide, but it's not. It is the greatest missed opportunity for true prevention of child maltreatment. And this is the big thing. Services are voluntary, but also intended to plant the seed and make families aware of services available in their own community. So although the families, when a community response provider reaches out to the family, is completely voluntary. They can say, no, we do not want your services. But at the same time, we're making the family aware of services that is in their community. So if anything in the future arises, they will know that those services are available to them. The work is centered around meeting families where they are and to prevent involvement within the child welfare system. We have 10 counties that are in the community response pilot program. and those counties are Montgomery, Clark, Powell, Bath, and Rowan counties. Those counties partner with Gateway Children's Services. So Gateway provides services to those counties. Kitten, Campbell, and Boone are being served through the Brighton Center. And then we have the Frisk and Barron and Perry counties that are community response providers. DCBS central intake staff will refer families to these community-based providers. A formal program evaluation is currently underway to assess effectiveness and inform the next steps. And we just currently got back the first round of program evaluation, and we're assessing that now. Supports provided with community response. We have parent skill building, appropriate discipline, tactics, improving behaviors of high-risk youth, caregiver, child relationship, including behavior management. We provide support to relatives / fictive kin if DCBS does not have an active case, poverty adjacent family barriers, early education needs, and supervision planning. Some of our data actually shows that one of the primary needs that families are utilizing is tutoring services. So we thought that was very interesting, especially right after the COVID pandemic. Other supports are home environment needs, barriers to accessing medical, dental, and mental health treatment, substance abuse issues, barriers to school attendance, legal needs. That's also families utilize that service a lot. Language or literacy barriers to accessing services, general concerns. Our Doris Duke work, we're very proud of that. We were one of 4 states that were chosen to be a Doris Duke recipient. The Doris Duke Foundation named Kentucky as one of 4 sites to receive funding as part of its new Opportunities for Prevention and Transformation. We call that the Opt-in for Families initiative. We will receive $9 million over the next 3 years to support economic and concrete needs for families. Opt-in seeks to demonstrate that actively connecting families at the earliest signal of need to direct support for basic needs and coordinated support services using trusted community partners is a cost-effective, scalable way to prevent abuse and neglect and keep families together. Doris Duke Foundation is providing ongoing support for Kentucky's community response pilot by using data, both qualitative and quantitative, to help scale the work for possible future expansion. This collaborative work will focus on experience from Kentucky's families and the voice of lived experience with co-designing elements / expansion. Okay, and on to our tertiary branch. Let's see here. Hold on. Our tertiary branch is designed for families that have came into contact with DCBS already. It focuses on families where maltreatment has already occurred, seeks to reduce the negative consequences of maltreatment, and to prevent its reoccurrence. The scope of work and responsibilities for the Prevention Evidence-Based Practices branch include the administration of all Family First Prevention Services programming, Families First Preservation and Reunification Services, Kentucky Strengthening Ties and Empowering Parents, K-STEP, if you've heard of that program, Sobriety Treatment and Recovery Teams, which is known as START, and prevention pilots, such as the administration of Intercept and multi-systemic therapy evidence-based practices. These programs are aligned with and supported by the Families First Prevention Act of 2018, and services to these families are administered by contracted prevention providers who are required to utilize evidence-based practices, EBPs, approved by the Federal Prevention Services Clearinghouse. These services are provided to families and children who have been identified by the Child Welfare Agency as candidates for foster care. Federal requirements for administration of these programs require fidelity monitoring of each of the evidence-based practices, as well as intensive continuous improvement procedures, which include case reviews of a sampling of prevention cases. These federally required activities are administered by the Prevention Evidence-Based Practice Branch. This branch is also responsible for the state's Title IV-E 5-year prevention plan. So what is alternative response? Many years ago, CPS was designed to respond to reports of serious physical abuse of children. Today, most children are reported to CPS for reasons of neglect or not having their basic needs met. What we know now is that some families need support or resources to be able to fully provide for their children. Alternative response is a way to meet these needs and keep children and families safe. To qualify for alternative response, the report contained a low or moderate concern of child abuse or neglect. Our hope is to partner with families based on strengths and work together to connect them to resources. CPS wants to support children and families staying together in their own home without the child welfare system involvement if possible.
So really quick, guys, I do want to add about alternative response. Alternative response and community response are different. I hear people talk about them interchangeably all the time. They're not the same thing. So community response is the report does not meet the criteria for any type of assessment. So it's sent to a community supporting agency. Alternative response means that it meets the statute for an assessment. However, it's lower risk. So we're going to take a different approach with that family. So just so that you know, again, alternative response does not sit within the Division of Prevention and Community Wellbeing. However, I get asked about alternative response all the time. So I include now some information, and Jenny actually had this information readily available to share with you guys, because I always want to make sure that folks know that alternative response and community response are two different things. Community response is more sitting in that secondary prevention realm, while alternative response is still considered a tertiary service. It actually sits with the Division of Prevention and Division.
We don't have
DPP.
any, of course, nutrition series, we didn't have anybody.
But anyways, with alternative response, it's actually operated through the field workers, through DSR.
So this is a chart comparing alternative response and investigations. The initial risk level, you'll see for alternative response, the information that's received by the CPS hotline has been initially assessed for the situation to be low or moderate risk. For an investigation, the information received has to be higher risk. So we're talking the examples of the risk level being low would probably be situations like a bad home environment, and a social worker would go in and meet with the family and discuss ways and supports that they can offer to help the family have a better situation. So when the social worker first goes out and meets with the family, they will set a time. So it's very different from an investigation where a social worker would show up unannounced. With alternative response, they will call the family and say, hey, is there a time that we can come out and meet? And when they talk to the children, initially during an investigation, they would talk to the CPS worker would talk to the children individually. With alternative response, they sit and talk to the family as a whole. The children are present. So they call, they schedule a time, and they have a team meeting with the whole family. When talking to others with alternative response, they have to have that family's permission to contact other individuals that may support them. With an investigation, the CPS worker could talk to collaterals without the permission of a family. Child abuse registry. Alternative response cases are not part of the child abuse registry, whereas with an investigation, they would be. Plans. You and your CPS worker would develop a safety plan if there is an active safety threat in the home. With an investigation, the family and the CPS worker would develop a plan to address safety in the home. There is no court involvement with alternative response. With investigations, it's possible that there is court involvement. Service completion. The family and the caseworker will have a conversation about the family's needs to identify resources that may help them. And unless there is an active safety threat, that family can decline services and the case can be closed. With an investigation, the family would be required to complete those services. New report with an open case. If you have an open alternative response case and DCBS receives a new report, the CPS hotline will decide if it's fit to continue AR or if it moves on to an investigation. With an investigation, if you receive the traditional investigative response and DCBS receives a new report, the subsequent report will also be investigated. So those are comparing the differences between alternative response and an investigation. Alternative response is more family-centered, and you do call and you schedule the meeting with the family and you all sit down as a team, and they can decline services.
So
So those are the
Kelly,
big differences. Go ahead.
Okay, so I seen your response or your question, alternative response, is it in every region or local office? Not yet. They're close. I think Jefferson will probably be the last place to roll out just because of the volume. And two, they have to identify staff because there are specific staff that are set to do just alternative response. Because it's a totally different way of engagement with families. And there is a lot of training that has to happen. A lot of attitude shifts, I'll be honest, in the community, because we have rolled out alternative response in some areas, and some of our court personnel have expressed concerns about alternative response. So we're using the contractor provider to kind of help us through having those conversations, really showing the data and the research, what that tells us about this new, kind of engagement of how we engage with families and not policing families necessarily, and not being that punitive interaction. So also too, something to think about, like I think yesterday or the day before I was working at Central Intake, and I was screening reports for them, and we got a report in, and it was that a new baby was born to mom. The baby was screened and the results were pending. However, they were concerned about some possible withdrawal. But then mom told them that she had used marijuana throughout her pregnancy to help with nausea. So the difference in that is that it was just marijuana. It's going to be considered an alternative response because we consider that a lower risk, right? Because we know about the effects of marijuana versus other substances they could utilize. Now, say that worker gets involved with that family and the screen comes back and baby has other substances in their system. Then they have the ability with their supervisor to consult about that case and bump that up to a traditional response if they need to take other action. But there's different things in a case, and it's actually within the structured decision-making tool that staff use at Central Intake as well to help them decide if it's a traditional response, which is that investigation, which I hate that language, but that's still the language that's being used. It's that traditional response or an alternative response. So it kind of guides that decision-making of what the risk factors and what supports you can also look at for the family to determine if it's a traditional versus alternative response. And Kelly, I think we were hoping by 2025 we would be statewide. We're not there. I think just because we've had some kickback and resistance, not from our staff necessarily, but even from some communities, that it's coming their way. So, okay.
So just
Jenny,
to close, Yeah.
You're
Oh,
gonna be
sorry.
talked. No, I said you're gonna be talked out, but go ahead.
So just to close this out, I like this visual. All children deserve stable and supportive families, while all parents need access to concrete support in times of need. In 2021, Kentucky had over 8,300 children in foster care. That's a lot of children, with 92% of substantiated cases of maltreatment identified as neglect. So you can kind of see that visual there. Prevention and preservation focused interventions in the child welfare system save the state millions of dollars. These are things our legislators like to see. With the proper assessment and supports, many children can safely stay in their homes or connected to family through family preservation services, even those with parents who struggle with mental health, substance use, or family violence issues. This visual, kind of shows, or it does show, from 2018 through 2022, Kentucky spent $11.2 million more on prevention, and then we saved $79.1 million on out-of-home care. And if you remember, Families First Act only was implemented in 2018, and our prevention branch really just started in 2023. So we're hoping that the next visual, the numbers are going to be even greater.
Now, granted, I will say, again, there is some new legislation that may contribute to some numbers and factors, but we'll have to see how that shakes out. So, guys, that kind of concludes us. I don't know if anybody has any questions or comments or concerns regarding the presentation or any other information that you would like to see or feedback.
Right, so I have a few questions. So first of all, I want to thank you all for coming and providing this information. And I think one of the things that you said earlier about those of us that are present on this call today probably support the same outlook, and we're all in agreement with this. And my question to you is, how can system of care partners help with this transformation and the work that we do? How do we support those that we work with and those that they work with in this shift in attitude? I love how this is framed with supporting families and empowering families versus policing families. And I think that that's definitely the old way of thinking. So what can we do to support this work?
So I think too, it's just making those connections, Vanessa, like reach out to local DCBS staff, reach out to cabinet staff about services and supports that you may have. Now, granted, sometimes when our DCBS staff are, interfaced with a family, it's already that third level, but maybe it's a report that's not going to be substantiated, but the family just needs some support. There are so many resources and new programs out there because I think we're all kind of diving into this prevention. It's hard to keep straight of who has what. I'll be honest, like I know that's the space I sit in, and it's like, oh, well, they have this program and this program exists. Make sure that we're making those intentional connections. So again, reach out to staff that you know in your local community. There's the regional prevention collaboratives that are occurring. Please join us for that. I see Chantel's on with us today. So we want to see folks participate in those. We want your ideas. We want to know what's going on with communities and families. And then also too, I just really want to echo, since I came into this role, how important it has been for me to engage with birth parents and lived experts, and even former youth that have been in care. It has been so impactful on the work that I do day to day and has changed my attitude and perception about things. And, I've done this work for a long, long time, and I didn't always do it right, and that's hard to say sometimes because I felt like I worked really hard and I tried to help families and support families, but I didn't always approach that in the right manner. And there were other things that I could have done to better support families. So just thinking about that, how you can engage folks that are, receiving services, make sure that they're a part of the conversation, make sure that they're at the table, helping make, design decisions. If you're talking about a new program or a new initiative, make sure you have them at the table with you, talking about what that needs to look like so that it is truly impactful. Does that help, Vanessa? Sorry, I gave you a mouthful.
No, that's very helpful. When I think about the work that REACTs do and how we have agencies represented at the REACT table that are employed with DCBS, that are employed with FRISC and the Administrative Office of the Courts and Office of Vocational Rehabilitation and the Special Education Cooperatives and all of those people that sit around the table that are not mandated members, that are non-mandated members or guests. And I'm just curious, like when we meet with those reacts, like, is there something that you guys suggest that we are maybe routinely visiting within those meetings just to make sure that this information is being passed along? Does that make sense?
Yeah, I mean, I think it's just to, like I said, continue to engage in your, the communities. If there's, if we're learning new information, kind of sharing it with everyone, because I know that there have been times we have like confirmation bias about certain things or how things are going or how, making sure that we're staying in touch and updating. Does that make sense with like the programs and services? And also, again, I will preach this forever, making sure that we keep families a part of the conversation always. That is the big key takeaway. And that's what I preach all the time, is making sure that we're keeping them a part of that conversation.
And so for some of the programs that you all talked about today that are not statewide, that are pilots or, just offered in certain areas, do you all have flyers that can be provided that we can pass along with our system of care partners to make sure that they're promoting the availability of those programs within their community?
Yes, we actually have a community response one-pager. It's actually on the KYA's website, but I can also send it out in email with a follow-up so that everybody can have that document as well. I do believe they are coming up with a one-pager on alternative response, Vanessa. I don't know that that's been approved and circulated yet, but if it does come, I can share that as well with you guys.
There's a brochure, Dana.
I know that they were working though on an updated one.
Okay.
Because I just talked to some DPP folks that they're going to update a new alternative response, kind of a public out-facing document. And then too, a lot of our information about thriving families is on KYA's website. You can go there too. Prevent Child Abuse Kentucky, I encourage you to visit their website. They have lots of new information. The Lean On Me toolkit is there as well. And then there's also contacts that you can reach out to if you want them to come to your agency, to talk about Lean On Me and community supporting and other resources and things that we can all do to help support families.
Yeah. The Lean
Sorry,
On Me
yes,
toolkit.
Kentucky Youth Advocates. Sorry, Kelly.
Yeah.
I'm trying to get out of that acronym language.
Yes. The Lean On Me toolkit would also probably be a really good thing to give community partners or people who's not mandated to be in the REAC, and just educating them about that website and make them aware of that toolkit. At least we're just planting those seeds.
And then also just engaging in conversations about poverty versus neglect. I think that's a big piece too. And two, I think we have to be aware of our own personal biases, because we have them, whether we want to believe it or not. We need to be aware of our own personal biases and perceptions and beliefs when we work with families, because we have to make sure that that doesn't cross into our work.
Okay. Hey, you are welcome to come off mute and ask a question if you have one.
Yeah, one, I wanted to say I really enjoyed this presentation. Just all the angles and all the pilots and all the initiatives. I was so appreciative to have this kind of in a one-stop shop. But I would say one question that came to mind when someone posed the question, on the activity, what would some of the responses look like if it was not in this space? Right. If this was, because this is a call with many social workers. And so, I think that was an important pause, because the reality is that communities shouldn't have to become social workers to understand how to navigate the system. It's almost like we create these systems and they're not designed for the people that they are meant to serve. And so the reason I think that so many people just report through the child welfare hotline is because they don't know where to go to find all of these resources. There's not a one-stop shop. And so it's almost like to even understand, you see on the feedback in the survey that KYA just released, there was information and testimonies from foster parents, birth parents, victim caregivers, youth about the child welfare system, and they talked about how they don't know their rights. They don't feel heard. They don't know what information and resources are out there, so they're overwhelmed. So when I think about that, is there a one-stop shop, or is there a portal? Is there a website where people can actually learn about this information? Like, is this information shared with like 211? If someone was to call into 211 Metro United Way and they went to their website for community resources, the Office of Globalization, they have a website, again, that has a lot of resources and information for, limited English speaking communities. Is this information shared with some of those outlets, number one? Because again, communities and individuals that are just trying to help, they shouldn't have to become social workers to figure out what is an alternative or a community response program that I can reach out to make a referral. The other question is, outside of 211 and 311 and globalization community response pages, is there another avenue? Because the digital divide is real, and there's so many people that are not going to all these websites. And so how is this information disseminated amongst communities and families that are not digital literate and are not online sifting through our DCBS websites? How are they getting this information in real time? If they call in, are they ever referred? Are these other options shared on the hotline, or if they call in, or if they, does that make sense?
So I wanted to talk about a few things. So Kay, you had mentioned about community response. How do you refer a family? So I'll be honest, community response, I think the reason we started there is because we knew that there was this high percentage of reports that we're not screening in, but that these reports had identified needs within that report. And then we would get another report and then another report. And then it would eventually meet criteria, right? Because things are spiraling, things are happening. So I think we started with community response and saying, we've got to do something when these reports are coming in. We're just screening them out. They need to be linked to a support agency. In my dream world, and I know it's dreams, communities, you would just know how to support a family. You wouldn't even have to call the child welfare agency. So it's not necessarily of how do I reach community response? It's what services are available in my community? Do I have a service such as Gateway, or is there a service that, that Brighton, something like Brighton Center in Northern Kentucky? Do we have parenting classes? Do we have food pantries? Do we have, a community action that I could give them the phone number or give them a ride to that location? That's more of where we kind of want to see communities being supportive of one another. And I hear what you're saying about expecting everybody to be a social worker, because it is difficult. It's difficult to navigate all these systems. I think the hopes is that Connect someday will be that one-stop shop where you can get on and you have the tiles. Now, granted, I hear you too, that it's all, it's electronic based, right? It's getting on your phone or getting on a computer. And that's why too, I encourage like these, and I know people kind of get worn down, but resource fairs and having that in-person contact with folks, handing out those old school pamphlets and flyers, I still think they're effective. I know we're all moving to the world of QR codes, and that's great, but sometimes that's not what everybody would benefit from. So having pamphlets and having flyers that have your information printed on there to give to a grandparent that's tangible that they can read, that might be easier for them versus giving them a QR code. Does that make sense?
Yes, absolutely. I'm glad you brought up grandparents raising grandchildren, because again, in communities of color and rural communities, there's not always that access to the internet.
Yeah.
So how do they get the same level of resources? So yeah, thank you.
Yeah, and then
And the
of course,
libraries, yeah,
yes,
the libraries are
and
one-stop
resource
shop.
hubs.
Yeah.
Like what I would like to envision is resource hubs too, having certain times when there's a live person there to help walk that individual through either signing up for supports and benefits. Now, we're not there yet, but that's kind of what we're talking about is how could we have folks come in that space? And, you know, we are really trying to do a lot of work with our family support side. We have been really historically siloed into our work and have not always connected. And now we're trying to, you know, develop some work groups around really connecting that work because they really, truly are one of the largest prevention systems that we have in the state of Kentucky. If you think about all of the individuals and families that they touch through SNAP benefits, through KTAP benefits, there's numerous Kentucky Works program and lots and lots of more programs, but they have several families that they come in contact with and touch. So just thinking about working with them as a partner and how we can be strategic in ensuring that we're, you know, in making sure that families have a streamlined way and remove some of those barriers to getting those supports and services. Yes, Dee Dee, I like that you said that because I hear that all the time from one of our lived experts. Go to the local dollar store, put that up on a bulletin board, print your pamphlet and
I
put it up
just
there.
said that. Yeah, that's some of the feedback we get from our lived experts.
Yep.
Yeah.
Yes, Dee Dee. Yeah, we hear it all the time. But
Dana,
she's right. I mean, she is right. And, you know, that technology is not always just the answer. We have to do it multiple ways. I think that's the thing. We have to make sure that we're providing it in multiple different avenues.
And Dana, I'm going to jump in. And the multiple avenues, yeah, and repetition. We know repetition matters. But I also want to say, like, the people attending this React Learning Series and hearing directly from you all today, and then all the people that they connect with, I think that makes a huge difference. So I just want to say thank you so much for everybody that attended this series.
Yeah, thank you guys for inviting us.
And you're exactly right. We are actually doing statewide community education about poverty versus neglect and, you know, supporting versus reporting. And hopefully the more that we're in communities and we're getting this information out there, it's spiraling down to others. You know, if we present this to you guys and you go out and tell 2 or 3 people and they tell a few people, it's going to take time, but hopefully we're getting the information out there. It's just a process.
Are there any more questions or comments for Dana or Jenny?
Ooh, I'm sorry. I wanted to say one more thing.
Sure.
Oh, God. I just again wanted to say I appreciate this information because I love the way in which the prevention division really lifts the advocacy part of our agency. I think from a community standpoint, like DCBS is seen just for its punitive actions on families. But this is an opportunity, like this is light, right? And it shows the advocacy that is happening, which goes so much further and such a long way to creating resilient individuals and resilient parents, which creates resilient communities and resilient children. So, so I love that aspect of this also. So I just wanted to, again, give you all your kudos and say, you know, that I love that.
Thank you.
Well, if there are no further questions or comments, again, I want to thank Dana and Jenny for coming today and providing this wonderful information. As a reminder, a recording of this session will be available in the coming days on the REAC Resources and Training channel. I have put that in the chat box along with the session survey, so please take a moment to fill that out. My email is also in the chat box if you need a certificate of attendance. We don't offer CEUs, but I can provide you with a certificate of attendance and the information that you would need if you needed to seek CEUs on your own. Our next React Learning Series session is scheduled for November 1st. The session title is Youth Impacted by Juvenile Justice Involvement. For this session, juvenile justice involvement includes those involved with the Administrative Office of the Courts and or the Department of Juvenile Justice. And we hope to see you there. So have a great weekend.
Thanks, everyone.